Hey there, everybody. So, a couple of thoughts for you today. We've had a few discussions recently with some of the docs that I work with and in affiliated offices that partner with the same dental support organization. And we had a few conversations this morning about how we can make our offices more productive. Speaking very generally, one of the more productive procedures that we can do for our patients is crowns. Now, we have to be cautious. I'm not advocating for doing anything unnecessary. I'm recommending that we perhaps change our mindset, our paradigm just a little bit to allow us to do these more productive procedures more frequently, because the more productive procedures actually, in the long run, can be a better service for our patients. So let me put it this way. Oftentimes a patient comes in, we'll diagnose a large multi-surface cavity, carious lesion on a first molar. And then oftentimes the assistant or we will treatment plan a large multi-surface restoration, whether it's direct or indirect, and the material of your choice. So the challenge now becomes, how long is that restoration going to last? If we do a big, let's just say we do a very, very large composite restoration that ends up covering 3 or 4 surfaces of the tooth, how long is it going to last? Well, we know that as those fillings get larger, the tooth gets weaker. The chances of the tooth actually fracturing and failing are pretty substantial as the fillings get wider and wider, past half the width of the tooth to 3/4 and beyond. So the question I would submit to you, and this is a rhetorical question largely, but how comfortable are you with the longevity of your large direct restorations? So how do you feel about how well those direct restorations are lasting in your clinical practice? For some people, the direct restorations can be phenomenal in their success and their lifespan. For others of us, they're not so good. I think as a whole, if you compare a direct restoration, an inlay or an onlay, or a crown or a veneer, to a direct restoration, like a composite resin, the indirects are going to outpace the directs significantly. And there are a lot of reasons for that. An indirect tends to be more precision. They tend to fit a little more precisely, and they're bonded in place, and there's less of that shrinkage factor. But also, when you look at a crown, the material is stronger, and the way that it's delivered creates a much stronger situation after the fact. So my suggestion is to change the way you look at what you're prescribing for your patients. If we do a large filling, we know at some point the next step is going to be an onlay or a crown. So is it better for the patient to be more conservative now so that we can be less conservative in the future? Does that make sense? I guess what I'm trying to say is, are we better off treating the problem twice or once? So that's the question I'd submit to you. I've gotten to the point, and I've learned from lots of the doctors that I consider as mentors in Kansas City and Albuquerque and in St. Louis, that if we can treat the problem once, whether that's with a crown or a crown lay or an onlay, as opposed to doing a filling and then doing a crown, then I think we're better off. Because we all know that the fewer times we drill on a tooth, the lower the risk of needing a root canal is. Then in the end, providing that definitive treatment sooner, which has a longer success rate, better prognosis, more control for us, a little bit easier, more productive for the office because it creates a better outcome for the patient, I think we'll be better off and we'll serve our patients to a higher degree. So those are some of my thoughts. I'm certainly not advocating for, if there's a situation where a conservative indirect or a conservative direct restoration would be appropriate. I'm not advocating for doing a crown just so you can bill out a crown. If it's not a justifiable treatment recommendation, absolutely don't do it. But if it is, where there's any of that gray area involved, and if you feel like in the end a crown would be a good service to the patient and save them from having to come back and do something again, by all means do that. That's it.